Hey guys, so this video is going to be about exercise called glute bridge. The main benefit of this exercise is teaching clients or patients or even ourselves the main difference between moving your hips and moving your lower back. So I will just try to demonstrate from sideline so it's a little bit more visible what is the main difference. A lot of times our clients, by extending the hips, they start to do basically this, and there is still a little bit of hip flexion left in the hips. Ideally, they would keep their back nice and neutral and they would move from the hips. This movement pattern can be very beneficial, let's say when they're deadlifting, swinging kettlebell, or even running and walking, just to be able to get that full hip extension in comparison to back extension. So I would say there are not much contraindication to this exercise because it's very low level, but if your clients or yourself, if you do experience some kind of increased symptoms, more low back pain, or just that position lying on your back is producing some extra symptoms, please just stop doing that exercise and just talk to your physician, to your trainer or to your physiotherapist. So for this exercise we don't actually need much equipment. Definitely some kind of mat would be nice, just so we are not lying exactly on the ground, and just some kind of small pillow or some kind of mat or padding under the head. So the starting position is just lying supine or just lying on your back. What you're going to do is you're going to bring your feet towards your backside, roughly hip width apart, feet pointed forward. Then, as you can see, I have support or a little bit of cushioning under my head, because the head ideally should be neutral, so your eyes should be pointing tiny bit downwards. When I leave my head in this position, it's kind of, I'm looking almost like upwards. So by raising it or lifting it a little bit off the floor, I'm going to achieve much neutral position. This is also going to help to decrease or to depress the ribs or just bring the ribs down. So with this feet hip apart, pointing forward, you're just going to take nice deep breath into the chest and then just breathe out as much air as you can. This breathing motion is going to depress the ribs and it's going to help to keep the pelvis a little bit neutral. Then you're just going to get your increased intra-abdominal pressure, which we did cover in the other videos, which I will leave in the description below. So if you are able to activate that increased intra-abdominal pressure, you're just going to then push your feet into the ground and lift your hips up into nice straight line, and then just slowly lower it down and just lift it up. During this motion, the main movement should be coming from the hips and not from your back. Oftentimes when this motion is causing extra pain, extra symptoms, patients or people are doing it like they're arching their back or they're arching their back on the very top, so they're not maintaining this kind of straight line from the shoulders to the hips. Common mistakes with the setup are basically putting the feet out, just autoing like this, which would be equivalent to valgus position during the squat. The other common mistake is just starting from this arched position or keeping the head down kind of into extension over here. Another common mistake is when pushing or when bringing the hips up to the ceiling, to push off the toes or to lift the toes and push from the heels. Ideally, especially I would say almost like from 99% people, it would be very beneficial to practice that tripod position. So you would have 3 points of contact on your feet, and you would be just lifting the hips and pushing them through. So again, how to do it properly is you are lying nice and upright, head is nice and neutral, your feet are flat on the ground, toes pointed forward, your pelvis is reasonably neutral, your ribs are down in the expiratory position. You're going to activate a little bit of intra-abdominal pressure. You're just going to raise the hips up, hold it for a split second, just slowly lower it down. As soon as it touches down, you can just lift it up and lower it down. You are not arching your back and you are not rounding your back too much, so you are maintaining this kind of straight neutral position. So if this exercise is basically too hard for you, sometimes the first step can be even like squeezing the bum and just lifting the hips maybe like just 1 inch off the floor is the first step, which will allow to decrease the protective tone. It will allow you to calm your nervous system a little down and decrease the pain. So let's say the glute bridge doesn't challenge you anymore, you are able to do 20 repetitions up and down, where you are just moving from the hips and your ribs are coming down all the time. Everything is nice and stable. Your next step would be to go from the bridge march. So again, just lifting the hips up and just marching with one leg while maintaining the pelvis position. And then the very next step would be just doing single leg bridges, which I'm going to be covering in the separate video. Guys, thanks very much for watching. Hopefully this video was helpful. Please like, share, subscribe. See you soon.